Is it clear? Like in the cases where the patient has a blood transfusion, in this case, the infection is not going to be starting from a point of focus, but it's going to directly have a systemic spread. Is it clear? So those are the different elements that you have to know on infections. So that's the particular mechanism of infection. So the first mechanism of infection, which is from the point of focus to the general spread or the systemic spread, is the mechanism based on the microorganism. Is it clear? So you have mechanism based on the microorganism, and the mechanism based on the microorganism stipulates that the microorganism is going to first start at a point of focus, and then is going to have a systemic spread or the general spread later on if the immune system cannot control the microorganism at its point of focus. Is it clear? Now, else the microorganism can also be directly systemic spread if we are going to have direct inoculation into the bloodstream. Is it clear? If you have direct inoculation, like in a case of catheters, in a case of blood transfusion, you have direct inoculation of the microorganism into the bloodstream, and then in that case you are going to have systemic spread. So this is a mechanism based on the movement of the microorganism in the blood, in the body. Now, the second mechanism on infection, still based on this term, we say that infection is having microorganism and actively dividing. So based on the microorganism, we just have microorganism actively dividing, and the mechanism is going to be that the microorganism can start from a point of focus and then it goes to the systemic spread. Now, the second element of infection that you don't have to forget is the immune response. Is it clear? So this is the second part of the mechanism of infection that the student, a medical personnel should not forget. And this is always what we usually forget. Is it clear? We need to know that what the immune response has two major components. It is either there is over immune response or there is under immune response. Is it clear? When there is over immune response is going to result to what? Over immune response is as a result of, because you need to know that when you have immune response, you're going to have the cyclooxygenase pathway activation. Is it clear? And you are going to have also the lipooxygenase pathway. Is it clear? Oxygenase pathway. So we have two major pathways. From the cyclooxygenase pathway, you are going to have the production of prostaglandins, and from the lipooxygenase pathway, you are going to have the production of the interleukins. Is it clear? The interleukins, and the interleukins are made up of the leukotrienes. Is it clear? And now all these two peculiarly are involved in immune response. Particularly the prostaglandins is going to result to vasodilation at the site and also systemic vasodilation, provided that the microorganism has a systemic spread. It can either result to local vasodilation if the microorganism is still located at the point of focus, or it can result to systemic vasodilation that can result to a septic shock when you are going to have a systemic spread of the microorganism. Is it clear? And now these other leukotrienes now help for the immune cells in order to cause the destruction of this microorganism. And the immune cells can either be the unspecific immune cells, which are particularly the neutrophils. Is it clear? The neutrophils, which are going to be used in the cases of bacterial infections. We're going to have the eosinophils, which are going to be used in the case of parasitic infections. We're going to have the monocytes, which are going to be used in the case of the viral infections. So these are unspecific. The monocyte or the natural killer cells are going to be used unspecifically in viral infection. Now, in the cases of the specific immune response, we need to know that what in specific immune response now, we are going to have instead the role now of the B cells and the T cells, where the B cells are the one that are going to produce the antibodies, and the T cells are the one that guides. It can either be the T helper cells, which guide other cells for the destruction of the bacteria, or it can also be the T killer cells. Is it clear? The cytotoxic T cells, which are the one that are going to directly kill the bacteria, the microorganism. Is it clear? So peculiarly, these leukotrienes are the ones that are going to be involved in opsonization, and that help in the regulation of the unspecific and the specific immune response, which is all. And the specific immune response is divided into two, which is made up of the humoral immune response from the B cells and the cellular immune response from the T cells. Is it clear? So that one is the first mechanism based on the over-immune stimulation. So when you have over-immune stimulation, the major problem the patient is going to have is going to be hypersensitivity reaction. Is it clear? So when you have an infection, you can have this mechanism that is going to occur. Is it clear? The hypersensitivity reactions, you need to know that it is divided into 4 types of hypersensitivity reaction. We have the type 1 hypersensitivity reaction, which is in the case of, and it's also called an allergic reaction, or it's also called anaphylaxis reaction. So you can have a patient that has generally the allergic or the anaphylactic reaction is going to occur when you have just you have an allergen to which you are exposed to. The allergen may not be an infection. Is it clear? So you just have an allergen, and that allergen is going to be the one that results to excessive stimulation of the immune cells that are going to result down to the type 1 hypersensitivity reaction. So now let's explain what happened inside the type 1 hypersensitivity reaction. So the first step in the type 1 hypersensitivity reaction is that we first have exposure to a particular allergen. Is it clear? The particular allergen, and then you have a gene